Why is it not stopping? Sorry. Oh, Caroline started a live video.
Yeah, because we're 3 minutes late. We were doing the whole Wi-Fi thing.
As always.
Oh, we're gonna have to turn the volume down.
Turn the volume down.
Hello, good morning.
Good morning.
If you're in London, a little bit later or earlier in other places of the world, but we're together.
Yes, we are.
We are. And I'm finally seeing Dr. Natalia's apartment,
and
which is very sweet.
My furniture delivered yesterday, so it was right on time.
Perfect. Yeah, I even had a bed.
Yes.
And it is amazing. We have glasses, we have a kettle, which has never been used. And it's wonderful. So, hello everybody. Hello Brazil. We are going to talk today about what we in our middle years are doing for our skin. And the majority of women I see of my age are doing filler. Saw you ranches 2 weeks ago. You look pretty in real life. That's so nice, Wafa. Thank you. Yes. Say hello next time. Yes, fill their faces.
Yeah, so the idea, and I just did a post about this a few days ago about kind of myths regarding dermal filler. So it doesn't go into the dermis, that's one thing. But besides that, let's move on from technical words. I have a lot of patients who come in and they say, I want to lift this, like, I even think you said that to me a couple times. Like, I want to.
But yeah, you want to lift the skin.
I want to lift the skin. I want this lifted. I feel like everything's sagging, like it's going down, which is a normal part of aging. You go from having a.
But you don't have to like it.
Yeah, of course. You have a reverse triangle to another triangle. So I want to lift this. So you'll have a lot of aesthetic practitioners who say, okay, I can put filler into the cheek here. Like we're taught that there's 3 injection points here, here, and here, and then you place filler on the bone, and that then lifts the tissue so that it removes that nasolabial fold and gives you that lift that women always want to achieve. And I've done it before to patients when I was just starting out using filler, and I was like, this doesn't do anything. So why am I doing this? It doesn't do anything.
And also it's temporary.
It's temporary, and it adds volume to cheek. And most women who have who lack or who are a little bit older, like over 40, you also lose temporal fat. So then you get that, you have that.
Yeah, we were just saying we like that though. I like a gaunt face.
A bit of a gaunt face is not a bad thing. So you have that, you have temporal fat loss here, and then people put filler there to then make a more oval facial shape, which is considered to be more youthful. But so if I put filler here, all it does is fill this area, and then you have a more pronounced temporal kind of divot.
Yes.
And then it doesn't do anything to lift the lower face. So filler doesn't lift. And
I've had a lot. I went somewhere and they put a lot of filler in the jaw.
In your jaw. Yeah, to give you structure here.
Yes.
Which will work in some circumstances, I think, if someone really needs a jawline. But most women, it's very emasculating to have a more volume here. Like, most women don't want a larger lower face. But yeah, you want that defined kind of line. Like Caroline has a very defined jawline, defined jawline. So there's a limit to what we can do, or I as a dermatologist can do with filler, Botox, and all that stuff when it comes to lifting. So that's when I hand my patients over to plastic surgeons.
Yes.
To do something else.
Facial yoga.
Yeah, so facial yoga hasn't really been it has been studied, but it's never been shown to do anything for your face. So because then what you're assuming with facial yoga is that the problem with the drooping face is muscular, when in fact it's not purely muscular. It's skin, it's fat, it's fascia, it's everything, it's tendons. So it's not just muscle loss, and it's not really muscle loss anyway. So if you're building a muscle, you're going to build the muscle in your face, and that doesn't really work.
Well, if you built the muscle in your face, so where's the muscle? Where is the muscle? Where are the muscles in your face?
So the muscles are quite deep under the skin anyway. So they're like in the cheek, your muscles are quite deep. You have your masseter muscle here, which controls your kind of helps you eat. And that can be slimmed down to kind of with Botox, you can atrophy that to give you a more heart-shaped face. But really, the muscles are very flat. They are skeletal muscles, so they are like, muscles like biceps and things, but they don't grow the way that your bicep would grow. So exercising your face doesn't really do anything for your facial appearance in a positive way.
But it may, with getting the blood to the surface, it may make your skin look better. Because people say that it works.
Temporarily glowy. Also, facial massage causes a mild amount of swelling in the skin, which can also make your skin look more plump and kind of.
So that's maybe why people say it works.
Yeah, and it's it's temporary, so it's not. You can do it. It's not bad for you. It just won't give you the effect that you necessarily want. But so yeah.
So you go through all of that stuff, and then you go to Dr. Natalia, who says, I think at some point the next stage is cosmetic surgery.
Cosmetic surgery, which is what I don't do. So I'm not a plastic surgeon. So there's a limit to where I would go with doing things.
And you are very honest about
that. Yeah. I'm about skin. So I like to improve. I can improve skin texture, obviously all skin disease. And in terms of pigmented skin or roughness and coarseness, there's lots we can do to improve the way the skin glows. And you have very glowy skin. It's like, we've worked hard to improve your pigmentation, and that's all very important. So you don't want to just go and have plastic surgery and not think about your skin.
No.
But
hand in hand.
They go together. Yeah. But I'm not a plastic surgeon, so I will advise patients that they occasionally may want to consult with a plastic surgeon to see what else can be done to help improve their sagginess or whatever the complaint is.
So talk about something else. We are 21, we're having a problem with our face, but that's what we're talking about today. But we'll move on in a minute. That's what we're talking about.
Yeah, today's about lifting.
I think it's probably 4 weeks ago on Thursday, I had a lower facelift. And I am really happy to report that not one person has noticed. And for me, that's what cosmetic surgery is about.
Yeah, it's like a subtle improvement.
A subtle improvement. I don't have any sagginess here, and I am very, very happy with the results. I didn't want to wait until I was 60, 65 when you'd walk into a room and somebody would say, oh my God, you've had a facelift. So for me, it's just tweaking the little things as you go along, as you age.
Yeah, and it's healed beautifully. I mean, it's only been 4 weeks.
I know, it is incredible.
It is incredible. Like the very minimal scarring. She has a little bit of, so the skin was tucked behind the tragus, which is like this part of your ear, and then sutured down, and then you had a drain behind your ear as well, which left you with a scar, but there's no scarring obviously here. You have a little line here, but that's fine. And what Dr. Claudia did 1 centimeter of skin, of tissue.
Either side she took,
1 centimeter. So
well, she said 2 centimeters, so I'm assuming it would be 1 centimeter
from either
side.
And 1 centimeter from a face, that's a lot. That's a lot of skin.
It's enough. It's
enough.
Not stretched.
No, and you were very swollen and bruised.
I wasn't bruised.
I thought, because you sent me the videos, I thought you were bruised. Maybe it was the iodine cleaning stuff.
Yeah, I really wasn't bruised. I was amazed because I was on Instagram about 4 days later, but I was worried that the downtime would be, I was a bit swollen, so I just wore my hair
you wore your hair down. And you can't drive.
Yes, I did a lower facelift. I had it in Dubai with Dr. Claudia at Cosmosurge. And if you go onto my website, it shows you what I have done with her. Do you do under eye bag removal?
No, so I'm not that. You need an oculoplastic surgeon.
Do you do a filler?
I do under eye filler, but not for someone who has under eye bags because it would just make everything worse. But if you have a fat herniation under your eye, giving you a bag, they can that's not a blepharoplasty, sorry, but an oculoplastic surgeon would go behind your eyelid, make an incision, remove that fat bag, and sew it back. So you would not even have a scar, because it's quite normal to get a fat herniation of your lower lid when you get older. So I don't do that kind of surgery, so I'm not an oculoplastic surgeon. But it is. I have to know about all of the other surgeries in order to be able to direct people. But yeah, so. How long
4 weeks on Thursday. What day is it today? Tuesday. Yeah, so 4 weeks on Thursday.
Was it painful?
So it's still a little bit swollen here. It's a little bit numb, but it's coming back day by day. And was it painful? The only painful bit was being bandaged and having my ears squidged.
You had that.
You know when you lie on a pillow sometimes and you think, I've just got to change position because my ear's squashed and it hurts. Do you ever get that?
Yeah.
Which is bizarre on a pillow. But anyway, so was it twilight sedation? No, it was full on 3-hour operation.
Were you tubed?
What's that mean?
Did you have a sore throat afterwards?
Probably.
No, I don't think she was tubed. I don't think it was a general anesthetic.
I think it was a twilight. Anesthetic.
Then you'd have been tubed with a tube and they'd have to take the tube out.
Well, I wasn't awake.
No, but you normally know because you can feel it. No,
but I was numb. My mouth was numb.
And then they can't tube you for a facelift. I don't actually know.
Oh, no, they can't tube you for a facelift.
I don't think that she was under a general. I think it was twilight sedation. But it's a very good twilight sedation because you don't feel anything. The results are permanent. Someone asked how long do they last?
About 10 years-ish.
Yeah, but I mean, because
depends how much you use your face.
Yes, and gravity and sun exposure, running, the normal things that cause aging will still continue to cause facial, like, I don't want to say drooping, but sag.
Yeah.
Yeah, as you age, because it's a natural part of your tissue kind of moving. So.
Can I show you my scar? Can you see that?
I don't know if they can. Yeah, you can see that a little bit. She has a little one. Right, it's right there. You can see the little scar, and then she has one behind her ear.
And so it went down the line.
It went behind the ear. Yeah. I didn't do the surgery, obviously.
No.
So yes,
it's very subtle.
It is very
subtle. How much did it cost? I think I actually, to be honest, I got it for their social media. They will be using the videos and photographs of it. So I was very lucky that I got it for free. But I think it costs about 50,000 dirhams, which actually is cheaper than London. I think London costs 25,000 pounds.
Yeah, that sounds about right. I had someone quoted a facelift in Dubai under 50,000 dirham. 150,000 dirham. 50,
yeah, that's what I much
150.
No, 150.
Yeah, she was quoted 150,000.
No, mine was 50, and it was one night stay. I could have stayed for 2 nights, but I just wanted to get home.
It is a major
and also,
procedure.
how much do you? It is a major procedure, but how much do you spend on fillers and all of that other stuff that I don't need now?
But also,
Claudia.
This is part of your kind of job. I mean,
it is my job, and maybe I'll lose work because of it. But I did it because I wanted. I had a brow lift 5 years ago, an endoscopic brow lift, again with Dr. Claudia at Cosmosurge. It's on my website, the before and after pictures. And where was I going? And every year, even then, I said, can I have a lower lift? Can I have a lower facelift? And she would say, no, go away. And finally, this year, actually, she contacted me and said, do you want your lower facelift? And I probably, honestly, I could have waited another 5 years. Okay. But it was on a plate, and yes, please.
Yeah, so, I mean...
Do fillers migrate?
Yes, they do. And there's been MRI studies of that. I have to put that into an Instagram post. So, yes, they migrate, yeah.
So, if you have them up here, then they're going to...
They probably go down. Yeah. So, when you feel like your filler is disappearing, it's probably not dissolving. It's probably just moving.
So, what happens with lip filler then? Does that actually... It moves up.
Because as the muscle works, that's the MRI scan showed that the lip filler goes into the upper lip area. You don't see it, but it's there. So, but it wasn't a mini facelift that you had, was it? Do they call it a mini? It's not a mini.
No, lift. it's a neck and lower face.
Neck and lower. Because if you did an upper facelift, they would have to go up here. I mean, again.
The brow lift was I think 4 incisions here, and they go in, separate the skin, go in, deal with all the muscles and
tissue.
So they don't really move the skin.
Yeah, it's not a skin lift.
No.
Yeah, so Caroline didn't have a skin lift. It was the entire kind of facial unit that was lifted. So the muscle, the fascia, everything was pulled up. But I think there is no. I mean, it is the best way to treat sagging skin of the lower face. There is really if you have pronounced sagging of the lower face, I would say that there's nothing else that you can do. And I know there's a lot of stuff that is sold as working, like all that kind of needle facelifting, electronic current facelifting, and you know, that kind of stuff. But again, I mean, it's just all no, it doesn't. It just thread lifts, not really. Don't really do the job.
Jowls. I had little jowls.
So jowls are what we're talking about correcting. So that's when this part of your face sags. What would I recommend?
56. I
mean, absolutely surgery all the way. I mean, it will give you that long-term result you want. I mean, again, I'm not a plastic surgeon. This is not something I'm ever going to do for anyone. But I kind of move patients away from filler and towards thinking about surgery if I don't think that, well, most people don't benefit from filler in the face, to be honest. Yeah.
But young people, like the young lady who is in her 20s, Mimi, I think she had filler in. She didn't want to accentuate her jaw. Oh, you can do filler in your nose to make it.
Yeah. So Dr. Peter does that at King's. He does nose correction with filler. Not everyone's like a good candidate for that, but he does that. And I do a lot of lip filler. I do love a bit of lip filler in people. So that's quite a good one. Mimi had something done, but she wanted to slim down her jawline.
She did, yeah.
So we did Botox into her masseter. So that's different. But there's not a ton. Filler can be used as a corrective method for things, but it's not really to change facial structure. Though in some, it's the rare circumstance you have a patient or someone who would benefit from a correction using filler. I do think filler is overhyped as something that's useful.
I don't think it's ever going to go away though.
No, it's never going to go away, but the way it's kind of sold as being something that can lift and make people look more youthful, I just don't think that's correct. Like, for example, I would never fill a marionette line. Because
really?
Why would you add filler here? Like, it just makes things look bigger.
I think you get filler, but I think I've had it above the line to sort of try and lift up the mouth.
Yes, so people put it a little smidge there and there to lift the corners of the mouth. Again, does that really do what you want it to do? Does it not just add volume to the sides of the lips? Yes. But yeah, are there different fillers for parts of the face? Yes.
Now there are so many.
There's so many different fillers for different. They're all different. Yeah. They're stiffer and softer. So I do a lot of lips, but that's mainly what I do because I'm not a huge fan of doing filler anywhere else.
I guess that's a compliment. So the what can we do to not age? So how would you start
with not aging?
Yeah.
I would stay out of the sun.
Bit of Botox? Stay out of the sun.
Oh yeah, stay out of the sun. I love Botox. That works every time. There's lots of evidence to support the use of Botox as kind of a general, really useful treatment for just generally making your skin look better. There's now evidence to show that Botox improves skin texture. It can reduce pore size. It can improve oiliness. There's evidence that it prevents the aging, kind of the appearance of aging skin. There's been some like twin studies and things like that. So I do love a bit of Botox. It does take consistency. So like every 4 months, you kind of have to go and have your Botox. So it's 3 times a year. It's a commitment. But in the long run, I mean, it's probably the best non-invasive cosmetic treatment. I mean, it's pretty invasive actually. It's a needle. That and a CO2 laser or any kind of ablative laser. But I would start, if you're starting to think that you have lines and you're worried about that, Botox would be your first kind of go.
An appointment, if you're wanting an appointment with Dr. Natalia, I think she's fully booked for December,
January.
But that would be at King's College Hospital. Yeah. And you're back in February.
Yeah. As long as there's no COVID disaster, I will be back at my normal monthly schedule from February. But I've had the vaccine.
Yes.
Yeah,
not sure about that. And for Dr. Claudia, she's at Cosmosurge in Dubai, and I can highly recommend her. She is from Brazil and is beautiful, as all Brazilians are. Eye threads, yes they are. Is it called? It's called the something eye.
Yeah, the eye threads. I mean, I know.
Eye or something.
I don't know what they're called actually.
But you don't do threads.
I don't do them because I just don't think they work long term. So they're meant to dissolve over a few weeks to months and then stimulate collagen to increase or whatever. It's just not a good treatment. It's extremely expensive for what it is. It's quite uncomfortable to have done, and it just doesn't give long-term benefit. Again, if you have that type of problem, you'd best be served with seeing a plastic surgeon, having a proper correction, a blepharoplasty, which is an eyelid lift, or like a lower facelift, then threading. Threads will still put you back thousands of dirhams. So yeah, it's relatively cheaper.
And they can go wrong. I mean, everything can go wrong.
Everything go wrong.
I once saw a lady and she had thread lifts in her cheek, and one of them had pinged or whatever they do, and she had a hole in her cheek, literally a hole. And but then I know a guy who had threads, and his face looks fabulous. Okay. Well, so, but the majority of doctors that I speak to won't go near them. Yeah, surgeons, that is. Yeah, and also what are we talking about? I've been reading the next question. Yes, the surgeon, Dr. Bray, Mr. Bray, said that he takes him ages to pick out the bits of thread when he's doing a surgery.
So he's not a fan?
He's not a fan, no. I'm 56 still. And where do they do the incisions for the brow lift? They do them up here.
It's endoscopic, so they're tiny little incisions.
Yeah. So totally invisible, but the downtime was big for that. I looked very city-eyed for a long time, and my husband was actually really annoyed with me because he thought I would look like that forever. But
did you know that you were going to look like that afterwards?
What?
Like temporarily have like a cat eye?
No, I didn't just have a cat eye. I'm literally
or whatever.
I could hardly open my eyes.
Oh my god! But did you know?
Because I didn't really care.
Oh.
I mean, also, if you tell somebody that, you just go, okay, well, at the end, as long as, and you have to wait a year for the results, really, the good results.
You do have to wait, even with like a rhinoplasty, you have to wait for like a year
for the end results.
For the swelling. I mean, this is not a short like thing. It is quite an unbalanced treatment. It's either you ace it or end up getting botched.
Yes.
Oh, is that about threads?
Yes.
Yeah.
Face yoga, we're not pro face yoga.
But it's not harmful to do. So if you like it and you think it does something helpful, then, go for it.
Well, yeah. And if it's making your skin glow. Then...
Is there any non-invasive method for a facelift? No. And I know that the thing is, if you Google non-invasive facelift, you will see like tons of stuff. Like there's just like this and this, and you could do this treatment, this treatment, this treatment. But I mean, like none of it's just a money-making like marketing scheme. So, I mean, I like to work with plastic surgeons in terms of collabing on patients because some of them do such great work, and they can get the results that the patients want. And I'm not going to faff around for years with these non-invasive treatments, charging people thousands of dirham or pounds or whatever, and then having them not get anywhere. It's just such a waste of money. So I like things to be effective and efficient. Like, do you know what I mean? Like, we like effective and efficient.
Yes.
And yes, in the short term, it may cost you more because you're paying a plastic surgeon for something. But in the long run, you're going to save yourself tons of hassle, and you'll look fab.
I did ask about jaw implants, actually.
Why would you want a jaw? What, here?
Well, I don't know. No, I just thought it would be, I quite like a jaw. Yeah, but anyway, no, that was a no. I do like a surgeon who's decisive.
I do too. Yes, absolutely.
Yeah, just say no to me.
Yeah.
I can leave annoyed, but just be honest. I love that. What about the neck?
Her neck looks better. I mean, better. Your neck looked good before, so I'm not. When I say that, it's
but
not.
It does look better.
It does look better. It does.
Definitely looks better. So, what would you do to a neck? So, I had oil therapy. Do not do oil therapy. A, it doesn't work.
It doesn't work.
B, I was numb down here for quite a long period of time. During it, my feet, I could feel.
Really painful, wasn't it?
Yeah, it was so painful. My toes were hurting.
Yeah, don't do oil therapy.
Don't do oil therapy.
It's such a total waste of money. So,
as so many of these things are.
These non-invasive things just, oh my God, like, even with microneedling, I mean, that's pretty invasive, but you have to do it constantly for like months and months and months to see a change. It's just not worth it. There's better things you can do that they cost more and maybe have more of a downtime in the short term, but in the long run, it's more cost effective and better. So, yeah.
Yeah. So I had a lower face and neck lift is what I had. And that was 4 weeks ago on Thursday.
Yeah, don't waste your money on therapy.
No, God, it hurts
Please
too.
Don't.
I mean, the pain. I know people who actually leave mid-course because it hurts
but
so
they
much.
charge so much for it. Anyway, what's the side effects?
I don't know what the side. You need to look up the side effects because also Mr. Bray said that it's really bad for you.
It's bad for you.
It's
I didn't
bad
know
for you.
Besides it being it's bad for your wallet.
No,
but it's bad for you.
No, it is bad for your. I don't know. I mean, if I can feel it in my foot, it's not going to be good.
No, it's not. So this lady keeps asking about IPL. So intense pulse light is not a laser. It's a multi kind of wavelength light treatment. It doesn't do any lifting or anything. So IPL can be useful for like general skin rejuvenation, but it is something that needs to be done continuously. So it can be good for a bit of mild redness. It can be good for some rosacea. It can be good for thread veins, but very small ones. But IPL, it's one of those things where you do need to continue to do it, and that's fine. A lot of things like that you do need to continue to do, but it doesn't do any lifting. So I wouldn't.
So is that something a younger person thing?
If you have something to treat like pigmentation or redness, then yeah. But I don't have many 20-something-year-olds who need IPL.
Right.
Yeah.
30s.
Maybe, but I would normally treat them with topicals.
Right.
Because they're going to use a face cream anyway. So, like, the thing is, most women are going to spend money on a night cream. So, if you're going to spend money on a night cream, you might as well buy a cheaper one, which is a prescription night cream.
Right.
Which is actually going to do something, and just use a moisturizer like any old moisturizer. So, because I know a woman is going to apply a skin cream every day anyway, I know that if I give her a treatment for her pigmentation and her, sun damaged skin, that it'll actually be used and it'll work when you use it.
Yeah.
So, and it's in the long run, it's very cost effective as a treatment.
What is PRN?
I don't know. PRN.
I don't know. Let us know, Simona, what PRN is. Healthy hair, you probably could answer that. I used your shampoo today, which was very nice.
Which was this grey bottle one, the one with the purple shampoo.
Yes.
Yeah, that's just because my hair had the wrong color in it for a little while. The secret to healthy hair. I've always had hair like this.
But hair is a thing.
Hair is a thing. We both have quite nice. PRP. Oh yes, PRP is like microneedling.
I've had that. Again, it's temporary.
Yeah, it's temporary.
It makes your skin glow. It looks lovely.
If you like it, it's kind of like a high-level expensive facial. Do collagen supplements work? The answer is no. But I mean, you have great hair, but it's very much genetic for you as well. I mean, my mother has great hair, so I think the person I have to thank is my mother, who, by the way, she's turning 70 on Friday.
Oh, happy birthday, Mama Spierings.
She's sleeping, so she's in the stage.
Why don't I colour my hair? I don't colour my hair because it cost too much and it was a complete waste of time going to the hairdresser every 3 weeks. And then I got my first modelling job at 53 because I was grey. So now I get work because I have grey hair. So why would I dye?
But is this all your natural colour then?
This is all natural. See, it's quite dark underneath.
Okay, so you don't get it like made more kind of grey, which I know sounds stupid.
No.
But okay, fine.
And also the other thing is, especially in Dubai, I'm one of the very few grey people. And I'm really embracing that now. I love walking into a room and being, and standing out.
People always recognise you when you go anywhere.
They do recognise me, which is a bit awkward when I don't recognise them.
You're the lady from Instagram.
Yes.
Yes.
Yes. So my diet, you can see also on my website, is everything I had to eat during a week, day by day.
Diet Pepsi, almonds.
Yeah, but also on YouTube. So that's talking to a dietitian about the negatives to my diet, not to be copied. Although I just like to go back and say, Nicola, you don't even need a facelift, by the way, because I know what you look like and you're gorgeous. You have a toned body. What is your diet? Well, almonds, sleep is the most important thing, isn't it?
Yes, sleep is very important.
Sleep, traveling is no good for sleep, but you can't do anything really in life unless you're getting sleep.
Yes.
I mean, you can't have good skin, you can't exercise properly,
think, work,
stress, all of that stuff. So good sleep then food, and then exercise. So since I had my lower facelift 4 weeks ago, I've done no exercise because I'm not allowed to.
Oh yeah.
I know.
Oh, I forgot about that. When can you start to run again?
Well, I guess when I go home. It's going to be really hard trying to start that up again. Yes, I do eat meat about twice a week. And last night.
What was that in?
It's Olivia helped to get a more beautiful face and hair. Olive oil? Olive oil. I use coconut oil.
Yeah, I like a bit of coconut oil. I'm not a huge fan of olive oil. But
why do you not use olive oil on your
because it can, if you have a tendency towards seborrheic dermatitis or dandruff, it can cause that to get worse. So I don't do olive oil. I don't tell patients to use olive oil. But if you like it and you're using it and you have no problems, I have some patients who like it and they use it, they have no problems. I'm like, okay, then just use olive oil.
Yeah, at the end of the day, you've got to do what works for you.
Yeah, I mean, I can tell you all the science behind all this stuff, but if, you know, and all the studies show this and this and this, but if you use something and you love it, well, you know, who am I to then say don't use that unless it's dangerous or in some way harmful. Yeah. But if it's not dangerous or harmful, do you use olive oil on your face?
We use coconut oil.
I don't, but I mean, again, like, it doesn't really matter unless you have something wrong with your skin, and then it does matter.
Going back to somebody who asked a question, supplements. I take Nutrafol. I know you say supplements
are rubbish.
If
you eat a balanced diet, or if you eat enough normal food. Yeah, I don't take.
But there are things in later life. There are things that you need more of.
Yeah.
Vitamin D, you definitely need.
Take vitamin D.
Yeah.
Even if you live in Dubai.
Yes.
Everyone needs vitamin D apparently.
How do we? Well, I do what you tell me to do for my skin.
Yeah, I use the prescription creams.
Prescription cream singular.
Okay, just one. Yeah, you just use one product.
Yeah. And you don't need anything else. So I use a cold cream as a moisturizer, and the retinoid, which is prescribed. So in the long term, that's no more expensive than going and, I mean, certainly isn't as expensive as going and buying La Mer, for example. Shouldn't have mentioned the name, should I? Is there anything else you can do other than the facelift for eye bags?
I mean, I'm assuming you have, well, you wouldn't want a facelift for an eye bag, you'd want the eye bag removed. I'm assuming you're referring to fat herniation under the eye. Again, I don't do that surgery, so you'd need to see an oculoplastic surgeon to discuss that, which is an ophthalmologist who specializes in the plastic surgery around the eye. So if you're gonna fiddle around with the eyes, I would see an absolute specialist, so an ophthalmologist who does eye surgery. So that's what I would suggest. Again, not my area, so perhaps they can suggest something else for you, but I'm not aware of anything else for under eye bags.
What is gonna make you more beautiful out of the oils? None of them are going to make you more beautiful, but the more glowing and happier your skin is, the better you are going to feel inside, which is going to make you more beautiful because you're happy.
Totally.
So start at the basics and get your skin sorted out. Like yesterday, talking to Jennifer about her 19-year-old who has acne.
Yes.
Get it sorted out. Yeah. Seriously. And then she's seeing a doctor who's not a doctor.
Who's not a doctor.
Thank God she saw you and you were able to look him up and find out. So she's seeing this expensive person in London who ends up not even being a doctor, and she's putting stuff on her face that is going to create more damage that you are going to have to fix.
Yes. So we're going to sort out, but it was pretty upsetting for me as well to see that. So. Yeah. I just don't. No one should have acne.
No, exactly. It isn't necessary.
No one should have acne. We can treat acne. It's totally treatable. Yeah. So if you're struggling with acne, I know it's not the topic today, but if you're struggling with acne, you know, please, we have such great treatments for acne, but they're not going to come. They're not going to cost you hundreds of pounds or dirham, and they're not going to come from a skin peel. And it's not going to come from like a series of something.
They are from me and Em. You are so clever, aren't they gorgeous?
Right.
How did you know that? I'm really impressed. I just got them yesterday.
I don't know how.
How did you know that?
That is so weird.
They are, and so's the shirt from me and Em.
That's
wow. I'm seriously impressed.
That is impressive. Yes, you can use retinoids on the back of the hands. Someone just asked that.
Yes, but then don't go in the sun.
Yeah, then you have to protect that area.
Yeah, and I'm not sure I'm ready to do that. Yeah. Do you know what I would take? having started...
sorry, 1 second.
Sorry.
That girl just said, I have PCOS. Is it fair to say no one should have acne? No. I'm not saying you shouldn't have acne if you have, like, if it's a thing that you have. I'm saying that it can be treated. So if you have acne or you're struggling with acne, see the right doctor and get it treated properly, because you can totally... No one should be suffering with acne. That's what I should have said.
That's what we're saying, yes.
No one should be suffering with acne.
It isn't necessary.
It is not necessary to be freaking out about your skin, suffering, because acne is so devastating for people.
And I think back in the day, if I may say that, we would say, oh, they're teenager, they've got acne.
It's part of being a teenager.
It's part of being a teenager.
Or you have PCOS, it's just part of having PCOS. No, it's not. Like, it's fixable.
It can be.
Like, just like with PCOS, if you have weird periods, or if you have infertility problems, God forbid, but if you had any of that, you would fix that problem. It's not, no one's going to say to you, oh, you can't get pregnant because it's part of PCOS. They try to help you. The same with acne. So if you have acne, and I'm not going to just say, oh, it's because you have PCOS, there's nothing I can do. Of course there's nothing I can do. Hello, we can fix it. So everything's manageable, sorry.
Yeah, sorry, certainly didn't mean to offend anybody.
A rant right there. Is hair straightening keratin safe? Yeah, I do that treatment.
I haven't ever dealt with dark circles. I'm lucky that I don't have to do that. Dark circles?
There's like no good treatment for dark circles.
Really?
I'm like the bearer of bad news today. Like, just nothing works for it. It's such a multifactorial problem. So yeah, sorry.
Alcohol in sunscreen.
It's probably not real alcohol, because there's a lot of alcohol, fatty alcohols. Yeah, so it's not like alcohol that you'd have in your vodka that's gonna like dehydrate. So I wouldn't carefully read the labels so much, because they're not. If you like the sunscreen, it doesn't matter if it has some type of a alcohol-y or sounding product in there. It's almost certainly meant to be there as a preservative or as part of the product. So I think just don't worry about that.
Right. Mr. Beginning, is it worth having fillers? I would say it is until you're ready for a facelift, but then when you're ready for a facelift, just go and get it. Do you think?
Yeah, just take a load out.
I mean, well, go and get it. Obviously expensive. When I had my brow lift, actually I paid in installments. And I think that is certainly at Cosmosurge, that is a possibility.
Yeah, all the plastic surgery places do that.
Yeah. So I bought my first watch. I got a loan out and did that.
Yeah, I mean, that's
yeah. You know. If it's something that you want that much and it's going to make you happy, then don't go on holiday and don't buy La Mer. And oh my god, I said it again.
Yeah, you need to stop saying that.
Yeah, I've got to stop saying
Thank
that.
you, PMNYCDXB. She's my patient, and I've managed her acne. Yay!
Yes,
have you heard about the Purita skincare? So yeah, so that is interesting too, because it showed that the SPF 50 wasn't actually a 50. But that's actually the case with a lot of sunscreen. So that's not hugely. I don't know tons about that, but it's not. When I heard about that, that wasn't surprising. So like, well, I always say sunscreen isn't enough. I'm always like, don't rely on sunscreen as your #1 form of sun protection. You know, use a hat, stay out of the sun, da da da. But sunscreen is like the third line, and I always get a lot of crap for that. But it's true. So.
You're not anti-perfumed products.
No. If you're fine with it, I love a scent. Yeah, if you're good with scent, then you can use fragrance.
I do. I love the smell of Clarins.
The skincare products.
I love it.
I don't know
absolutely love it. I've loved it always. So that's fine. Morning, evening, morning, flannel, hot water, moisturizer with sunscreen. Yeah,
I do the same. I don't always use a moisturizer.
You don't always use a moisturizer in the morning?
No,
I don't always use one. Well, I don't use one at night time because I have the prescribed retinoid.
Yeah, okay. No, well, that's probably why you need one in the morning. But I use a really heavy, I use like QV ointment or Hydromol or something super greasy at night. So then I don't normally need it in the morning. So then I go to the gym with the remnants of that on my face still.
And a bit of mascara on my cheek.
Yeah, I have a little bit of greasiness going on, and then I go to the gym and I come home and then I usually wash my face after that. So
excellent. Well, do you like La Mer? Do you know what it is? I've never tried La Mer. As far as I know, it's one of the most expensive creams on the market. So I'm not saying don't use it. I know plenty of people who use it and they love it. If you love a product
and you're willing to pay for it,
yes, then you should do that.
Just use what you want to use. Just like if you like shoes, just buy them.
I've been sent some Tata Harper, which is I don't even know how much La Mer costs, but I know that it's very expensive. Target Harper is pretty expensive, but it was sent to me. The smell is amazing. I'll let you smell it when you come over.
Oh, okay.
It's beautifully packaged.
That's important.
It is that's important. Yes, it looks lovely on the shelf. It smells out of this world, and it is a good cream.
Okay.
But
I mean, if you like, I mean, if you liked it and you want to, like, I spend money on certain things that other people wouldn't spend money on, that they think is a waste. So
yeah,
you know,
whatever floats your boat.
Whatever works for you. Like it. I'm not gonna tell you how to spend your money. Ooh.
I think probably, is it okay to use moisturizer in your nose?
On your nose. And the black dots, if you have. Yeah, it's okay to use a moisturizer. You may not need it, but it's okay. But there are treatments for, well, those little black dots aren't super easy to treat, but
black dots.
They're sebaceous filaments, the little the hair follicles, kind of like blackheads. Yeah, you can just extract them. I like the
pores. Then they fill up again.
Yeah, they do. There's no like cure for those, but though you see people doing, they're using the what's that laser called? Someone's using some laser on Instagram and showing how they're making them disappear, but it's also temporary. Like, oh, she loves La Mer. Okay.
Yeah, do you know what? I've never even smelt it.
I haven't either. Maybe we can do that today.
Yeah. They probably won't let us try it though.
They won't let us touch it because of COVID. Yeah. Okay.
But anyway, do what makes you happy. What do you spend my money on? What do I spend my money on? If I earn money, then I might buy myself a pair of shoes.
Yeah, I do shoes. I just bought a load of furniture for my new flat, which is what we're sitting on. So I spend a lot of money on furniture. So hi Philippa.
When I have my own home, I don't own my own home. When I own my own home, then I'm gonna spend all my money on my home.
Yeah,
I can't wait.
That's almost
that's
totally
so
what
exciting.
I've done.
I'll feel so grown up when I do that.
Yeah, I feel really grown up. Yesterday when I got my furniture delivery, I felt very grown up. It's like, look at that furniture.
For me though, I do spend money on shoes because I never have in my life. It's a new thing.
Oh, okay.
Since I started working at 53, because prior to that I was really only earning pocket money, and now I'm modeling and loving it, and I kind of feel like I have places to go, and there are events, and generally I'm there with younger people, and younger people are all about looking fabulous, designer and everything, and so I don't want to be turning up in Russell and Bromley loafers.
No.
So I'm enjoying my life, basically.
Yes.
Antibiotic pills work for the nose, little blackheads. My dermatologist put me on it.
I don't think that he or she would have put you on it for that, because that wouldn't really work. So I'm not sure. I don't know you, so.
But you can go on antibiotics for maskne.
You could, yes, you can. Yeah. Well, yes.
Because that's a long-term thing at the moment.
Yes. Oh God, yeah. We have to get masked.
What do you think about New Face? Worth it or not really?
Is that?
I think that's
which one's the New Face
rolling
one?
It's the little thing that has two little. It kind of looks like a nose hair clippers.
I can't remember what gadget that is. I'm so sorry.
It has two little balls.
Is that the? Okay. Is it like a massager? Is it like a jade roller?
But it probably is electric.
If it's like a jade roller, then no, it doesn't do anything.
Okay. What can you do for textured chin? Yes. CO2 laser.
CO2 laser. We're gonna do another one.
Yes, I have that, and totally.
Yeah, it worked. We're gonna do it again though, because it needs.
But we need to go deeper.
Yeah, Caroline, you had a neck lift, brow lift, and lower. No. She had the endoscopic brow lift was 5 years ago.
Yes.
And the neck and lower face is all one unit. So that was one procedure. So that's not a lot for that's a standard, So it's two different though. Like it was two different things.
And I don't think there's any point in doing a lower facelift if you're not going to do your neck as well.
I mean, I think it's all connected though. Do you know what I mean?
Yeah, but why would you do one and not the other?
You can't really though.
No.
Like technically, I don't. Not that I do the surgery, but technically, I don't think that's possible.
Yeah.
But yeah.
What is CO2 laser?
Oh, it's an ablative laser, which kind of it makes little holes in the skin, and it basically burns it. It totally resurfaces the top layer of your skin, and then stimulates collagen, to rebuild within the dermis.
And your skin looks like baby skin.
Yeah, to improve the texture of the skin, and then over time it will slightly tighten the skin and improve kind of that cobblestone chin appearance, which is done really nicely for you.
Yeah.
But it takes time. It does take time to
yeah,
kick in.
Definitely. That is what I'm going to do down here. And it didn't hurt. And it fixed really quickly.
Yeah, it did. But we didn't exactly blast it. No. So when we do it again, we will.
My birthday.
Yeah, we'll blast it. But next time, thoughts and
Dermatologists, we don't do that. No?
No, we don't do
No, we don't do that.
The neck, any issues for lines? Yeah, retinoid.
Oh, do you do Botox in the neck?
I do. I can. It's for the platysmal bands. So it's if I don't have that problem, but because I'm not skinny enough, but you might have that. Not really. It's for the you know when people have like very lean people have or very kind of they have these bands of the tightness that pulls. Those are called your platysmal bands. You can inject those with Botox to relax them.
Right.
And that can make people's neck look less, I don't want to use stringy.
Sinewy?
Yes.
Yeah.
And kind of stringy. And that's why you would, inject Botox into the neck.
Right.
It is not comfortable.
No, I have had it and it hasn't been an issue. I had a friend who had it and she couldn't swallow.
Yes, correct. So it can, because it obviously
terrified.
relaxes the muscle, so the pharynx, so it can affect your ability to swallow.
Yeah.
And I did something similar to Mimi, and she also had trouble swallowing or chewing after, because I did this area here on her.
Right.
And she had a little bit of funniness with it, because it can happen.
But it was sorted.
You had a smash lift. Sorry, someone asked a deep lift or the super. What's this MS? See, I'm not a plastic surgeon. SMAS, SMAS, I can't remember what it stands for, but that's what you had.
That's what I had. And I don't dye my hair. This is all natural, which is why it's dark underneath and grey on top.
What's your natural hair color?
I guess it's this dark brown colour.
It's not really brown.
Isn't it? Is it grey?
It looks black on the screen.
Oh, it's not black.
But it's not black. Sort of it's like brown. A dark brown.
Yeah.
It's similar to my natural brown color, which is okay. This is okay. So, well, this is my natural color, but I had my gray. I know it sounds horrible. I had my gray covered because I have little bits of gray, and I'm not
ashamed of your
I am
gray?
not. That's the thing. I'm not ashamed of my gray, but I'm not ready to go completely. Because if I left it, I'd develop I'd have to. You did a whole thing with that hairdresser about how to go gray, so I need to watch that and understand it. But right now I'm still
Jack Martin, hair colorist
Jack
of the
Martin
stars.
of the hair colorist of the stars. But I'm gonna. It's not a ton, so anyway.
Yeah, you're gonna have to let it go one of these days.
I will let it go one of these days.
Right, gorgeous skin. Thank you very much. See a dermatologist.
Doesn't have to be me though. There's lots of
make sure that they are
actual
a doctor.
Yeah, make sure they're a doctor.
A consultant dermatologist.
Yeah, try to see
a
consultant.
Right? Yeah.
Just check the credentials.
Not a cosmetic dermatologist.
Yes, I get slack for this all the time.
Yeah.
But
if you have an issue with your skin, see an expert.
See an expert.
It's like seeing a gynecologist or seeing a GP.
Correct. And GPs can do some stuff for gynae. Yes. But if you're not getting anywhere with the GP or you're still having your gynae problems, then it's best to see a specialist. Yes. So it's not nothing against cosmetic doctors. Some of them they do excellent work with Botox and things like that. But when it comes to a proper skin condition or looking at moles or anything like that, they're just not the right person because they just don't have the training or experience. And it's not, it's not a personal thing. But it's true. And most cosmetic doctors will say that as well. They'll be like, "Oh, I don't know how to manage this. It's outside my remit," which hopefully it's beyond your scope of practice. Anyway.
Do's and don'ts with food. I don't do sugar or carbs during the week. And you can see my food either on my website or on my YouTube channel.
During the week.
Do you have do's or don'ts? Oh, and then I eat anything I want at the weekend.
Anything she wants on the weekend. No. Oh, I do, but it's not really my area.
Right. But you're pretty healthy.
Yes.
Yeah, lots of veggies.
Yeah, I don't eat crap, basically. So,
I do it at the weekend.
And you do. I don't do that, though. No, I don't do that. But I don't eat crap.
It is so lovely to be with you. And I'm going back to Dubai tonight. And you're coming over for Christmas Eve. We're going to have Christmas together, which will be great fun.
We'll have to do a live.
I've ordered my turkey.
Yes. Our turkey. My turkey.
Yes. What keeps you so happy? I think because thinking of the opposite. What is the opposite? It's sitting at home, not meeting people, and I love meeting people. I think it's being scared of the opposite and ending up in an old people's home lonely. And I don't want that. And I'm 56. I'm only 56. I have years ahead of me, and I'm getting new experiences all the time. I'm going on some extravaganza in France in January, which will be awesome. I went to China last year. I've done so many new things, and I expect new things to continue happening. So that's why I'm happy.
So, and the question is, do you always eat well, Caroline? No, she doesn't.
Not at the weekend.
I've seen it.
Yeah, I do like minstrels and Maltesers.
Yeah, she's not a saint and crisps.
No, I just live my life.
She's not.
But I'm good at the week.
She's not a food obsessive saint. No, guaranteed. You know.
The doctor's name, Dr. Claudia, for the surgery in Dubai at Cosmosurge, and Dr. Natalia, who is based in London but goes to King's College Hospital in Dubai about once a month.
Yay.
Thank you.
Sure.
Happy Christmas, everybody.
Merry Christmas. And I'm sure we'll do another live.
Yeah, when you're in Dubai.
Actually, probably after Christmas.
Yeah, around Christmas time.
When I'm in Dubai. Bye, everyone.
Bye.
Have a good day.